We are here asking the Guilford County Health Director, Dr. Yulia Vaughn, your questions about COVID closures and much more. You can text us your questions. This text question says, my husband's work has had a few cases, but employees were told that as long as they were not in close contact for longer than 15 minutes that they would be fine. Is that true, and where did the 15 minutes come from?
Yes, thank you for that question. That is absolutely true. That is the guidance that we're using right now. Close contact is defined as spending 15 minutes or more, 6 feet or less than that in person. And that guidance comes from the CDC. And that has been the guidance that we have been using from the very beginning of the pandemic. So that is true. That information is correct.
Okay, so that is what's considered close contact, is 15 minutes within that 6 feet.
Yes.
And that could be something that you're having contact with someone. All right, now this is a follow-up. So do we call the public health office if we have an employee with COVID to investigate the situation?
Absolutely. Please give us a call and we will be more than happy to look into that situation. Probably by the time that you call us, we already have a positive lab report on that person, but it's better to call us and alert us so we can keep an eye out for that than not. So we don't mind if you give us a call to let us know.
This person's asking, is the health department working closely with Guilford County schools to make sure it's safe to bring students back to class?
Absolutely. The work that we have done with the Guilford County schools has begun in March of this year. So we have been constantly working with our school district in the first part of the pandemic and the last part of the semester over the summer to help with the planning and the operations and everything that they need to do to put in place all of the best practices and the logistics of all of those safety measures and mitigation strategies, and most recently working with the school system around the metrics that will be used in order to identify if our community is going in the right direction for the students to gradually return into the classroom when it's safe, when we feel comfortable that our numbers have the right trends, and having all of those prevention measures in place in the schools in order for both the students, the staff, and the teachers to be safe and protected. So yes, we have been working extremely close for months now, and we will continue to do so because we know that this is a partnership and this is a collaborative approach, and we need to work together in order to get the best outcome.
This text question says, can you please explain a cluster and when they end?
Sure. So a cluster is a collection of 5 or more cases that are somehow linked to one another. It can be based on activities that are being done together, based on the fact that they live together, that they work together, or that they exercise together. So those particular areas can be can fluctuate, but basically is some type of link between these cases. And also it ends at 21 days after the last positive case that is being identified for that cluster. So what would that look like? If today we have the last positive case that is being identified, then it will end or will be considered officially closed 21 days from today, because we know that all of those infectious cycles have ended and incubation cycles, and we can feel comfortable saying that that cluster or that outbreak has ended.
Okay. We answered a whole lot of questions in just a short 15 minutes. So thank you so much, Dr. Van, for being with us. We appreciate it. We thank you for your text questions. If you missed something, hey, don't worry about it. We're going to put it on our YouTube page and on our website as well. You can take a look for the Two Wants to Know section as well, again, as the WFMY News 2 YouTube page.